This video will provide you with a brief overview of the Rotoprone therapy system. As with any product, please familiarize yourself with all applicable product manuals and quick reference guides prior to any patient placement or product operation. It is not intended to replace formal education conducted by an Arjo representative. The Rotoprone therapy system user manual is located under the patient's surface. Please consult the prescribing healthcare provider regarding individual patient therapy goals and follow facility treatment protocols. When Rotoprone is in actual use, no socks or gown is recommended. Ventilator settings, ET tube placement method, and securing device are not actual recommendations. They are for educational purposes only. Initial setup, brakes, and power. Initial procedures required before transferring the patient to the Rotoprone. First, ensure all 4 brakes are locked, the system is plugged in, and the lock pin at the foot of the patient's surface is pushed in. Next, to activate power, press the on-off switch at the head of the bed. Time and calibration. Within a few moments of activating power, the date-time screen will appear on the monitor located at the foot of the bed. Verify the correct time and adjust if necessary by touching the Save New Time button. Next, the Rotoprone calibration screen will appear. Press No. The Arjo service rep should have already prepared the system for use, and there is no need to recalibrate. If your unit is kept on site in storage, calibration may be needed. Please call 1-844-55-PRONE for assistance. Welcome screen, same patient. Welcome to Rotoprone. The Welcome to Rotoprone screen will now appear on the monitor. Please carefully read the important information on the screen. Once you read the Arjo statement for use of the system, press the button in the lower center of the screen. Next, the Welcome to the Rotoprone therapy system New Patient screen will appear. If this is not a new patient, press No, and all of the patient's data will be restored, and the home screen will then appear. Welcome screen, New Patient. Welcome to Rotoprone screen will now appear on the monitor. This screen is for a new patient. For a new patient, press the Yes button to clear the previous patient data. This will prompt a confirmation screen to clear all old data. Press Yes to confirm a patient, and a setup wizard will now be displayed. The wizard will walk you through the process of inputting the prescribed settings for supine and prone therapies ordered by the patient's physician. If you need help navigating the software, push the Help button for assistance. Press Start to activate the wizard. The Setup wizard first takes you into the supine therapy settings screen. Your first choice is to adjust pause times for the patient's right, center, and left position. The pause time is the amount of time the patient is held at the maximum angle programmed into the system. Press Next after each button to advance through the settings. Your second choice is to adjust the maximum angle of rotation for the supine position. Once you have set the desired pause time and maximum angle of rotation for supine, the screen will be advanced to the prone therapy settings. Continue through the prone settings in the same manner. The screen will then advance into the therapy settings selection. Set the direction of the prone rotation by pressing the Prone Direction button. This is the direction the patient surface will turn when rotating into the prone position. Always rotate the patient's surface toward the ventilator to reduce risk of extubation. The acclimate mode gives the option of slower adjustment to the targeted rotation angle. Once the prone direction has been determined and the decision to use the acclimate mode has been made, press the Next button to advance to the final screen. The final process in the wizard setup is to zero the scales. Verify that all patient accessory packs that will be used are positioned on the patient's surface before zeroing the scales. Press the Yes button on the screen to start the process. Press No if you do not want to zero the scale. If the scales have been zeroed, the scale screen will appear. The display button may be pressed to view weight in pounds or kilograms. Press the Done button in the bottom left corner of the screen. The home screen will now be displayed. This indicates the patient's surface is ready for placement. Please note that the lock pin will need to remain in engaged locked position until the patient is in place and all packs have been secured. Preparation and placement. Patient placement prep. The next step is to clear the patient's surface. To start, stow the prone packs under the patient's surface. Unbuckle the prone pack strap on top of the surface, then lift the pack while pulling the silver pin to release it. The pack will release when pulled. Be sure the pack is well supported. Snap the yellow strap to the prone pack, which stores the packs, off the patient frame. Carefully swing the pack under the patient frame until it locks in place. There will be an audible click when it's locked. Repeat for the remaining 7 prone packs. Next, adjust the side supports to the outermost position by using the hand crank located on the patient's right side of the surface. Once the side supports are in the outermost position, pull the metal ring and stow the hand crank, then grasp the handle on the side support and pull the metal ring to unlock the side support. Then lift the pack off the surface. The leg abductor pack will now be removed from the patient's surface. Pull the knob or ring on the post bracket pin at the foot end of the patient's surface and turn a quarter turn to release the leg abductor pack and lift it away. Move to the head of the bed and pull the silver knob on the right side to open the hoop hatch. This is designed to allow for patient transfer without interrupting the patient's lines or tubes when they are placed into the tube management system. Use caution when opening and closing the top frame hoop latch to avoid pinching hair or clothing in either the hoop latch or the hoop hinge. The tube management system is specifically designed to securely hold multiple tubes and lines close to the patient head during rotation and prone therapy. Ensure black knobs are tightened on the tube management system as demonstrated. To remove the face pack from the head support, press and hold the release plates, then lift up and remove. Open the head support by turning the black knob counterclockwise until the sides are almost flat. Locate the head support adjustment handle on the underside of the patient's surface. Turn the hand crank until the adjustment shaft shows approximately 2 inches of clearance. Remove any other accessories from the patient's surface. Use the hand remote control or the main control panel to adjust the height of the patient's surface to the same level as the stretcher or other surface supporting the patient. Patient placement. When transferring the patient to the Rotoprone, follow all facility protocols and universal precautions. Do not leave the patient unattended at any time during the patient placement. Position the patient on the Rotoprone surface and center their head within the head support. Align the patient's ears with the openings in the sides of the head support pack by slowly closing the head pack to lightly touch the patient's face. It is very important that the patient's ears remain aligned with the openings in the head support. Proper positioning and alignment of the head and ears determines optimal support for the patient head. Check the head position often during the remainder of the patient placement procedure, especially when all other packs are positioned and tightened. Turn the black knob on the head support clockwise to tighten until the sides are lightly touching the face. Then center the patient's body on the surface. Route ventilator tubes and other upper body lines through the opening at the head end of the bed and secure the lines into the tube management system. Secure the ventilator tubing in the designated opening within the tube management system on the opposite side from where the ventilator is positioned. Once all lines and tubes have been placed in the tube management system, press the black button on the left side of the hatch to close the hoop. Next, route chest tubes, Foley bags, fecal management system, sequential compression devices, and any femoral place central lines through the opening at the foot end of the bed toward the main display panel. Do not hang or tie any equipment on the sides of the patient's support frame. Use the hand control remote to adjust the patient's surface to the lowest level if raised during patient transfer. Now you're ready to place the support packs on the patient's surface. All support packs and the face pack are required for prone positioning therapy. For supine rotation, the lower leg prone packs and either the chest or pelvic prone packs are required. First, install the leg abductor pack. This helps to support the patient's feet and legs and to ensure proper positioning at all times during rotation. Separate the patient's legs and position the pack. Set it onto the patient's surface and insert the pack posts into the receptacles. Push the post down into the receptacles and pull and turn the lock pins on the post bracket to release and lock the pins in place. Then adjust the foot positioning pack, footboards, by lifting the pin and sliding the foot pack until it touches the heel of the foot. Route the lower body catheter lines through the midline notched areas at the bottom or top of the leg abductor pack. It may be helpful to utilize both notched areas if there are multiple lines involved. Make sure the lines have adequate slack to avoid pulling or tangling during rotation. Next is the placement of the side supports. In order to optimize the fit of the side supports, determine the shape of your patient by assessing the width of the hip in relation to their chest. Each of the side supports have a concave and convex side. For example, for an individual with pronounced hips, the concave side of the side supports should be placed toward the patient. For an individual with narrow hips, the convex side should be placed toward the patient. The side supports are interchangeable and can be used on either side of the patient. Choose the best fit for the patient, which can help minimize patient migration during rotation. Extend the patient's arms 90 degrees to the side while positioning the side supports. The side supports can also be placed in two different positions at the front end of the surface. You can choose the inside or outside guidepost to accommodate for the patient's upper body. Placing the end of the side support in the inside guidepost will provide for a wider upper body range. Placing the end of the side support in the outside guidepost will provide for a more narrow upper body range. Now you will need to unbuckle the arm slings located on the side supports. Place the patient's arms into the arm slings and buckle them closed. This will help secure the patient's arms during rotation. Utilize the hand crank on the patient's right side of the surface to center the patient and tighten the side support packs snugly against the patient's side. Packs need to be tight enough to prevent the patient from sliding from side to side when rotated. Snugness of the packs will vary according to each patient's body type. Recheck each time the patient is moved from supine to prone. Insert a hand between the side support packs and the patient's thighs and hips as the packs are being positioned. When the packs feel snug against the hand, remove your hand and ensure the patient is secure. For smaller patients, the top end of the side support packs can be extended to support the patient's thoracic region. Pull up on the knob on top of the side support and extend the pack towards the patient's axilla. Insert the U-shaped pads into the gap to protect the patient's skin. Be sure to leave 2 inches, approximately the width of 2 fingers, between the end of the pack and the patient's axilla to help reduce any pressure on the vessels and nerves. Once the side supports are in place, the abdominal sling can now be placed. The abdominal sling will help to support the abdomen during rotation. Place the abdominal sling on top of the patient with the Velcro strap facing up. Be sure to look at the diagram to ensure it is placed properly. Feed the Velcro straps through the gray loops or bridges located on top of the side supports and angle them away from the patient's skin when securing them. Next, the accessory inserts will be added to customize the fit of the therapy system to the individual patient's size and shape. Each accessory insert is labeled with a diagram of where the insert can be placed. However, individual packs can be interchanged to accommodate patient body types or critical lines. Start at the front end of the surface and move toward the patient's head, ensuring to place packs over shins, hips, and chest. Prone pack placement. To release the prone packs, use one hand or knee to push up slightly while pulling out the silver pin that holds it in place. Unsnap the yellow strap support and bring the lower leg prone pack up and center over the lower leg insert. The prone pack arm can be moved laterally to accommodate different size patients. Simply take one hand and slide the prone pack arm across the base of the patient's surface. Shorter patients may not require leg packs for support. The prone packs must still be secure for the unit to operate. If the prone packs are not used, simply secure them below the patient's feet. To help minimize possible skin breakdown, position lower leg prone pack so no pressure is applied to the patient's foot or toes. Fasten the 2 lower prone packs together with the buckle and pull the strap to tighten firmly. It is very important to not place any accessory inserts directly over the knee, as this could cause excessive pressure and/or hyperextension of the knee. Position the upper leg prone pack across the patient, over the upper leg and the insert. Fasten the buckle and tighten the strap. Do not place pelvic prone packs over the upper abdomen. Placement of the pelvic packs should allow for abdominal expansion during proning. Make sure that any femoral placentral lines are not bent, compressed, or kinked after prone pack placement. Fasten the buckle and tighten the strap. Next, place the wedge insert over the patient's shoulders with the cutout portion over the patient's neck. Ensure that the chest prone pack is positioned closest to the head of the bed. Make sure the chest prone packs and the wedge insert allow for proper chest expansion to enable ventilation. If not, the wedge insert may be reduced by removing one or more of the foam inserts within the wedge, or the entire wedge insert may be removed completely. Ensure there is adequate clearance between the top of the chest or wedge insert and the bottom of the head support. Fasten the buckle, but do not tighten the strap until just prior to proning the patient and after checking the face pack. The tightness of the prone pack straps will vary according to the patient's needs. The straps need to be as tight as can be tolerated while allowing for proper chest expansion during ventilation. The patient will shift into the prone packs and away from the patient's surface when moved into the prone position. Face pack placement. When preparing the patient for prone therapy, the final step is to position the face pack on the patient's face. The face pack can be placed at either the beginning or the end of the patient placement. This educational video demonstrates the face mask placement at the end of this patient's placement. However, clinicians may place the face pack at a time that best suits the circumstance. Position the face pack on the patient's face by aligning the top opening of the face mask with the patient's eyebrows. The face mask should be positioned so that the eyes can be fully visualized without causing pressure on or around the patient's eyes. The U-shaped openings on the face pack should frame the packs around the patient's mouth. Adjust the position of the metal cheek plate around the patient's mouth as needed to accommodate for endotracheal tubing. To adjust the face packs, turn the adjustment screws to loosen the cheek plates. The cheek plates may be raised or lowered as needed to accommodate a patient's facial shape. Tighten the adjustment screws and pull the cheek packs off the Velcro and reposition as necessary. Once the face mask has been adjusted, insert the face mask strap into the head support assembly. Secure the face pack so that it is gently touching the patient's face to secure the patient's head. The straps will click as they are tightened. Do not over-tighten the face mask. The face pack should only be pressed down so that it rests lightly on the forehead, cheeks, and chin, with no compression of the foam. Remove the face pack at frequent intervals to better assess the eyes, ears, and surrounding skin. Fitting the head support, face pack, lower leg prone packs, or other packs too tightly may increase pressure points, possibly leading to skin breakdown. Assess skin at frequent intervals according to your facility's protocols, depending on patient condition. Give extra attention to skin at pressure points, bony prominences, and in locations where moisture may occur or collect. Common pressure points include, but are not limited to, the face, ears, axilla, shoulders, sides, and upper and lower extremities. Early intervention may be critical to reducing risk of serious skin breakdown. Perform final placement check. Ensure the patient's head is secure within the head support. Ensure face mask is properly positioned. Ensure patient's hands and arms are fastened securely within side pack arm slings. Ensure side support packs are snug against patient's sides. Ensure all prone pack buckles are securely fastened and straps are adequately tightened. Lastly, tighten chest buckle. Start supine therapy. Start therapy in supine position. Once the patient is completely secured on the rotoprone surface, you're ready to start therapy. On the control panel, push the Scale button. Then press the Save in Weight Trends button and make sure to pick up any bags or equipment that may be hanging on the accessory rack. This will save the patient weight and can be displayed in weight trends. Scales and patient weights are for reference only. Scale reading should not be relied upon for medication dosage. Press Home to return to the home screen. Kinetic therapy begins in the supine position and will continue until directed to move to prone. Once the patient placement is completed and the patient is rotating in the supine position, only then can the patient be moved into the prone position and begin therapy. First, pull the lock pin and an important checklist will appear. Check and clear each item on the checklist by pressing the corresponding button. The arrow will change to a check mark. First, assess all invasive lines and tubes, ensuring lines are secure and have adequate slack to avoid pulling, tangling, binding, or dislodging during a full rotation. Once all lines are adequately secured, press the Check Tubing button. Second, examine the patient's airway. Ensure the endotracheal tube, ET tube, and the ventilator tubing are secure and have adequate slack to avoid pulling or twisting during a full rotation. Once the airway is assessed to be adequately secure, press the Check Airway button. Third, examine the patient's placement in the head support assembly. Ensure the patient's ears are aligned with openings, the eyebrows are aligned with the top opening of the face mask, and that the face mask straps are securely tightened appropriately. Once the patient's head is clear, press the Check Head Support button. Once the entire checklist has been cleared, the Start Rotation screen will appear. Press the Start Rotation button and kinetic therapy will begin in the supine position. To stop rotation immediately at any time, the lock pin can be pushed in. Move to prone position. Prepare and move to prone position. If prone therapy is prescribed, press the Prone button and the Prone Preparation screen will appear. Press and hold the Rotate and Lower button to move the patient surface to 0 degrees supine, lowest height, and to cancel any Trendelenburg position. Once the patient's surface is level and fully lowered, the checklist screen will appear. Again, to clear each item, press the corresponding button and the arrow will change to a check mark. Check the tubing, ensuring all lines are secure. Check the airway, ensuring the endotracheal tube, ET tube, and the ventilator tubing is secure. Check the head support, ensuring the patient's head is properly positioned. Check the arm slings, ensuring the patient's arms are secure but not too snug within the slings. Check the abdomen support, ensuring the abdomen has been adequately secured. After all items have been confirmed, the Face Pack Caution screen will appear. Re-examine the patient's placement in the head support assembly. Pay particular attention to the position of the face mask. Gently tug on the face mask to ensure it is securely fastened in place. When the head position is satisfactory, press the Confirm button. Ensure the cheek buckle has been tightened. Consider moving EKG leads to the patient's back. The Move to Prone Position screen will appear. Use the main display panel located at the foot of the bed or the hand control remote control located at the head of the bed. Press and hold the Prone button to turn the patient into the prone position. Once the patient is at 0 degrees prone, the checklist screen will appear. Open the top hatches to assess the position of the patient's head and neck. Check for the proper head and neck alignment. If alignment is needed, turn the head support adjustment handle, which is located directly above the patient's head, to raise or lower the patient's head to the desired position. Place EKG leads on the back if repositioning them to prevent skin breakdown on the anterior chest wall. Next, turn the hand crank for the side supports to ensure the patient is still very snug within the prone packs. The number of revolutions will vary depending on the size of the patient and the shift of the body weight when placed into the prone position. Reconfirm the checklist and the Start Rotation screen will appear. Press the Start Rotation button and the rotation therapy will begin as programmed. Once the patient is in the prone position, the upper body, midline, and/or lower body hatches can be opened for better visibility and access to the patient. Be sure to monitor the rotation for 2 full cycles to make certain that all lines are properly secured and have adequate slack to avoid binding, pulling, or dislodging. Also observe the patient for movement or shift within the packs. Make any necessary adjustments to the face mask to ensure that the patient's eyes are visible and that there is no pressure around the eyes. At the completion of the patient placement, adjust therapy settings as needed. Nursing procedures. Let's examine how simple it can be to use the Rotoprone therapy system in conjunction with nursing procedures. The home screen can be displayed when not utilizing the touch screen. There are 6 icons on the main display home screen, with additional options under each category. The Prone Supine button takes you through the process of moving the patient from the supine position to the prone position, and alternatively from the prone position back to supine. The Therapy Settings button allows you to adjust both prone and supine maximum angle of rotation and side pause times. The therapy settings can be changed at any time during patient placement. After changes have been made, press the Home button to return to the home screen. The Scale button allows you to view current patient weight. The Hold Patient Weight button holds the current weight value in memory while equipment is added or removed. The Zero Scale button recalibrates the scale to 0. The Display button displays weight in pounds or kilograms. The Weight Delay button postpones patient weighing for a specified length of time. The Adjust Weight button sets the scale to a known patient weight, and the Weight Trends button accesses the weight trend chart. The Surface Position button allows you to adjust the height and angle of the patient's surface. Maximum Trendelenburg and reverse Trendelenburg angle is 11 degrees. The Park button allows you to rotate and hold the patient's surface from 0 to a 60-degree angle to allow for nursing care procedures and to access the backside posterior of the patient. Press and hold the button of the desired position. It is possible to stop at any angle by removing your finger from the desired angle button. In this example, we will park the patient's surface on the patient's right side at a 45-degree angle. Therapy will be deactivated and the patient's surface will move quickly to the selected position. A 30-minute timer will begin. After 30 minutes in this position, an alarm will sound and the control panel will prompt you to resume therapy. Now that the patient is in the prone position and parked, you can access the patient from one of 4 hatches: 2 upper body hatches, 1 midline hatch, and 1 lower body hatch. When opening the hatches, it is recommended that the patient's surface has been rotated to a 45-degree angle to enable easier opening of the hatches. To open the hatches, simply turn the black handle and lift the hatch open. While in the prone position, the upper body, midline, and/or lower body hatches may remain open during the active rotation up to 62 degrees. To close the hatches, reposition the cushions inside the frame, close the hatch in a downward motion, turn the black handle clockwise to retract the locks, release the handle, and turn the latch until it locks into place. To deactivate the park position, press the Home button and the safety checklist screen will then appear. After you have confirmed and cleared all of the items on the checklist, the Start Rotation screen will be displayed. Press Start Rotation and the home screen will appear and therapy will resume. The last button is the Therapy Meter screen. The Therapy Meter screen displays daily and cumulative kinetic therapy time in both prone and supine positions. On this screen, you can access for a specific date of therapy to be displayed or access the therapy chart. To facilitate the placement of an X-ray cartridge, open the upper hatches and lift up on the center bar, spine bar. There is no catch or hold for the center bar, so be sure to securely hold this while placing the X-ray cartridge. Set the cartridge in the desired anatomical position, close the center bar and hatches, and return to the supine position for the X-ray. Open the chest and abdominal packs and take the X-ray, following hospital protocol. After the X-ray, return patient to prone position and take out the film. Skin assessment. It is recommended to assess the patient's skin at frequent intervals. Keep skin clean and dry. The use of a moisture barrier cream may be used to decrease friction and shear. Replace shear pressure pads as needed and apply fresh moisture barrier cream as needed per your facility's protocol. Maintain a 1-inch clearance or 2-finger breadth between the end of the side support packs and the patient's axilla. Remove the face pack at regular intervals to assess the eyes and surrounding skin. The face pack should be removed while the patient is in the supine position. Be sure to inspect the face pack foams for saturation. Face pack foam should be replaced every 72 hours or more frequently if soiled or saturated. Breathable underpads are recommended for incontinent patients to minimize the soiling of packs, manage microclimate, and protect the skin. Disposable pads may also be used. Watch for incontinence or drainage and provide appropriate skin care following each episode. CPR function process. The Rotoprone therapy system features an automated CPR process designed with patient safety in mind. it features 3 separate CPR functions. First, there is a red CPR button located on every screen in the control panel. Second, there is a red CPR button located just below and to the right of the control panel. You must press and hold either CPR button to move the patient's surface to a 0-degree supine to the lowest height. Third, a red emergency release handle is located on the right side of the foot end at the base of the system. The manual emergency release handle is recommended to be used only in the event of a power failure or screen malfunction. Before beginning any CPR function, close all hatches and ensure the latches are secure. Press and hold the CPR button on the main display touchscreen or the red CPR button located below the control panel on the frame of the system. The CPR mode screen will be displayed. You must press and hold the CPR button until the patient's surface is leveled, lowered, and rotated into the supine position. Once the patient's surface has reached 0 degrees supine, the screen will direct that the lock pin be pushed in. If there is a power failure and a need to move the patient from prone to supine, use the emergency release handle and follow the emergency release procedures to disengage the belt drive and manually rotate the patient to the supine position. It is very important that all hatches are secured and locked before manually rotating the surface back into the supine position. Using 3 caregivers, 1 caregiver manipulates the emergency release handle and 2 caregivers are positioned on each side of the frame, supporting the frame. The caregiver manipulating the emergency release handle will pull the lever toward the foot end of the system to disengage the belt drive. Then the other 2 caregivers will manually rotate the patient's surface to the supine position. Once the patient has reached 0 degrees supine, the caregiver manipulating the emergency release handle will re-engage the emergency release handle, pushing it towards the head end of the system. Then push in the lock pin to secure the surface in the supine position. Follow hospital policy and procedure for placing the CPR board prior to beginning CPR. Unbuckle and stow the prone packs as needed. Unfasten the abdominal sling and fold to one side. Remove the side support pack and all necessary inserts. Remove the face pack. Emergency manual rotation to prone instructions. In case of an emergency or power failure, use the emergency CPR procedure to manually turn the patient from the supine to the prone position. Follow the instructions on the yellow label on the middle right side on the foot end of the Rotoprone therapy system. At least 3 people are recommended for this task. Patient must start at 0 degrees supine. Lock pin must be pulled out. Determine the proper direction for rotation, always prone toward the ventilator. Instruct person 2 and 3 to secure patient for proning and monitor all tubes and lines. Disengage emergency release handle if necessary. Break tab to open door and access manual rotation lever. Lift and hold manual rotation lever for the duration of manual rotation. Note: audible notification will sound and red indicator light will illuminate while manual rotation lever is active. Instruct person 2 and 3 to rotate patient to prone position. Release manual rotation lever and re-engage emergency release handle. If at any time during the placement you encounter different system alarms, please consult the Rotoprone Operations Manual for complete descriptions and corrective actions for these alarms. An alarm will sound when the patient has been in one position more than 30 minutes, when the maximum recommended prone time has been exceeded, when an obstruction has been detected, or if any other critical fault has been detected. The Rotoprone therapy system delivers the benefit of prone positioning along with kinetic therapy in an automated system for critically ill and immobile patients. This video has provided you with a brief but comprehensive overview of the Rotoprone therapy system. As with any product, please familiarize yourself with all the applicable product manuals and quick reference guides prior to any patient placement or product operation. The Rotoprone Therapy System Operations Manual is located under the patient's surface at the foot end of the system. Please consult the treating ordering physician regarding individual patient therapy goals and follow facility treatment protocols. For further information regarding the use of Rotoprone, contact us on our 24/7 clinical support line at 1-844-55-PRONE.